Today on Primary Care providers. Studies show you're more likely to live longer if you have one.
Everyone must partner with someone who will oversee their health.
Hello, I'm Dr. Lonnie and welcome to Primary Care, the show dedicated to improving the health and care of African Americans. If you have a relationship with a primary care doctor, a lot of conditions like diabetes, high blood pressure, and kidney disease can be diagnosed early. You can also catch cancer in its very early stages and possibly change many of your health outcomes. Unfortunately, in today's climate, there are far too many people who wait until they are sick or in a crisis to see a doctor. There's an estimated 100 million people or more in the United States that don't have a primary care physician or provider. Studies show that not having one can lead to life-threatening outcomes and a poorer quality of life. Here to discuss the importance of having a primary care physician is Dr. Gwendolyn Graddy. Dr. Graddy is a board-certified physician in internal medicine and geriatrics. She is currently overseeing the medical education at PACE of Southeastern Michigan and is a strong advocate for everyone having a primary care doctor. She is also a staunch warrior over the years in this community and a patient advocate par excellence. Gwen, thank you for joining us on the show.
Thank you, Dr. Joe, for having me.
Please speak to us a little bit why it's important for everyone, particularly African Americans, but everyone, to have a primary care provider.
Yes. So first of all, let's be clear about what a primary care provider is. You know, traditionally when one heard the term or the abbreviation PCP, one thought of a primary care physician. But over the years, that's expanded. So now when someone hears primary care provider, not only does one think about a physician, but also advanced practice providers like nurse practitioners or physician assistants. So now let's talk about why it's important. Everyone must partner with someone who will oversee their health. That includes making certain that they get maintenance exams, that they have screening, their immunizations are up to date. But you know what's equally as important? That person then becomes their partner if something happens.
Exactly.
If they have to be hospitalized, if they have to go into an emergency room, you must have a partner, and that partner becomes your primary care physician or provider.
So there is a risk, an inherent risk, in not having a PCP.
Absolutely. And part of it you actually mentioned. There are diagnoses that if they are caught early, they may be prevented, well, not prevented, but we may be able to stop them from progressing and having a poor outcome. Breast cancer is a perfect example, and the importance of mammograms. So having a primary care provider or physician, someone who knows who you are, and by the way, they understand based on your age, what exactly it is that you need to be having. So having someone who can oversee that for you, make certain that you have what you need when you need it, is vitally important. Yes.
So you're talking about building the old-fashioned provider-patient relationship again?
That would be it. I remember growing up when our family doctor, as he was called,
yes,
would come to the house and see me, or see my sister, or see my brother. And even if the physician now doesn't make home visits, and by the way, home visits is a new thing. It's a wonderful thing to see how a person lives, because you do get a different perspective of an individual when you go into their home. But it is so important for everyone to have someone that they have that partnership with, that they have that relationship with, and I'm going to use a really big word here, Dr. Joe, that they trust will take care of them.
And that is not an immediate situation that you find yourself in called trust.
That's correct. It is really something that develops and evolves over time, but it starts with developing a relationship, or at least starting to develop a relationship. And so when one sees a primary care physician or provider, the development of trust starts on day one. Does the provider answer your questions? Does the provider look at you when they're talking to you? I've had an unfortunate situation where an individual, usually older, comes in with their daughter, and the physician doesn't talk to the patient, who is the older individual, The physician talks to the daughter. Well, for me, I wouldn't be able to trust somebody who can't even look at me when they're talking to me. So it's something that develops and evolves over time. So yes.
I recently had a patient tell me, stop banging on that computer and look at me.
Ah, lesson learned, huh?
Yes, absolutely. So building this trust takes time.
It does.
It's a two-way street.
Yes, it is.
Because we are recommending things to patients that they should do, and we kind of expect them to follow those things unless there's a reasonable reason not to.
Exactly.
So how does one pick a primary care provider?
Yes, so there's several things that one should consider. First of all, consider that the primary care provider or physician is someone that you can get to see. Now that may seem simple, but if I can't get to your office, then I can't have you as my primary care physician. So logistics, can you get to see them? Number two, are they available to provide the services that I need? So number three, are they available to answer questions when I have questions? And another important one is, will my insurance pay for that office visit? So those are some of the things that one would consider. You know, where they're located, are they available? Will they answer my questions if I have questions? And when I leave that office visit, can I be assured that that office visit has been paid for and I don't get a big bill in the mail?
So assuming that we're hitting on all cylinders, all those things that you mentioned, which, by the way, are equally important. It's just as important to have availability as it is to understand the insurance situation. So we're hitting on all cylinders. So how often, once I've chosen this person, how often should I see them?
Yeah, well, that depends. It depends on your age, it depends on your risk factors, and it depends on your existing health problems. And so a younger person may not need to be seen more than every 2 years. But as we age, Dr. Joe, the tendency is that we may need to be seen more often because the risk of developing certain diseases will increase. Or if you already have an existing disease, let's use hypertension because that's so prevalent in the Black community, you may need to be seen more often so that your physician can check your blood pressure to make certain it's responding. That is if you're taking your medication. And also have the opportunity to discuss how you're doing with the medication, side effects, potential complications, and if for some reason you can't afford your medication, that's another important conversation to have with your physician.
Sure. So these things are dependent, interdependent.
Yes.
If your last office visit necessitated a change in your medication, it might necessitate that you're seen sooner instead of later.
Absolutely. And so to go into a physician's office, be started on a medication for a new diagnosis, and to be told, I'll see you in a year. Totally unacceptable.
Yes.
You may need to be seen the next day or the next week. So the frequency of visits really has to do with the age, the risk, and the existing medical conditions.
So in the whole scheme of things, I may be doing something to a patient in an office that because of the system not paying attention to these necessary points along the way, your mom winds up in the emergency room.
And then that becomes a problem, and it becomes a problem for two reasons. Number one, and again, because my emphasis is on geriatrics, let's talk about geriatric patients for a minute. The emergency room is not the best place for an older person to go. Emergency rooms are wonderful for any of the emergency room physician colleagues that are listening. However, if that emergency room visit can be avoided for that older person, it's not the best place to go, and for several reasons. Number one, they may sit there for long periods of time before they're seen. And number two, they don't know that person. And so the likelihood that they may be started on a medication that their primary care physician had already started and it didn't work for whatever reason, potentially that person can be put in harm's way because medications are not appropriate for them. So you want to keep them out of the emergency room if you can.
Not to mention the cost is significant, especially in terms of risk-sharing contracts that doctors are driven into, the hospitals have to sign. All of that cascade says, boy, it's best to keep that person out of the emergency room and use it when necessary.
Absolutely. So there is a time and a place for an emergency room. But when we can keep people out of the emergency room and we can treat them in the physician's or the provider's office, that's what we should do. When you look at people who are dual eligibles, that means those who have Medicare and Medicaid, which is about 12 million people in this country, those people typically have the most hospitalizations simply because it's something called potentially avoidable hospitalizations. The diagnosis for which they went into the emergency room for and were hospitalized for, if they had a primary care physician in the community, that condition can be treated in the community. Diabetes, hypertension, asthma, COPD. Many of those, if they have a primary care physician, they can see them on a regular basis, they've developed a relationship with, they trust, then those hospitalizations and or emergency room visits can be avoided.
So when we put our business hat on as physicians, Gwen, what you're saying is that eventually we should be able to affect the cost structure of the system.
Yeah.
And by not making sure that that is included in this whole delivery of care, if we don't do that properly, all we're doing is guaranteeing that cost goes up.
Absolutely. And unless we have enough primary care physicians, the cost will go up. Because if you don't have a physician's office that you can call, that you can go into and be seen, where are you going? Many people get their primary care in an emergency room. So first of all, we have to have enough primary care physicians, and that's a whole nother topic that I can get on, starting with medical schools, you know, what we're encouraging our students to go into. So the need to have a primary care physician who really can be the overseer, as it were, to partner with that individual to provide them the best care in the best place at the best time.
Absolutely. And I think it's showing in our society, in our healthcare delivery systems, because we're not doing well in pediatrics and we're not doing well in geriatrics. All of the negative statistics are on those two ends of life. We're stuck on some phrases and some acronyms and buying into some ideas that it's fine, but we're getting away from what did work. And that has been taken away from the patient population. And as a result, you know these numbers. That's why we have single-digit control of asthma in the pediatric population in a city like Detroit. We're not going to go off on that tangent too much.
But it's a point.
It's a
and
point.
dementia, when we talk about older folks,
exactly.
that's a whole nother subset that we
thing,
can talk about in terms of how well we're managing them.
Absolutely. Not to mention that we have to look at the total situation that the patient is. If we believe in a holistic approach and a total care approach to the patient, we have to believe in looking at and subsidizing services to that situation that the patient is in, the caregivers, the other social things that are quality of life issues that have to be considered. But the fulcrum of this whole thing starts with a person and a relationship that you can rely on, that you can call your physician or caregiver.
Absolutely, absolutely.
Gwen, when we talk about a primary care provider or a primary care physician, which areas of medicine does that entail?
Yeah. So specifically, when we talk about primary care physicians, there are different specialties. So there is a family medicine physician that covers the whole spectrum from childhood to death. There is an internist or internal medicine physician, which is basically adult medicine. There's a geriatrician, which basically focuses not just on those who are older, but those who are medically complicated, and usually those who have dependency and activities of daily living. They need somebody to help them toilet or bathe or feed them. And then there's the obstetrician and gynecologist, who basically is the reproductive year age women and also focuses on pregnancy and caring for that particular aspect. So when we talk about physicians, those are typically primary care physicians.
So patients sometimes are not aware of who actually is doing what. And there's been a distinction in this country for a long time that in the modern practice of medicine today is not fair, and that is between MDs and DOs. I mean, there used to be this gulf, but now we're seeing people across the spectrum who are very well educated on both sides of that aisle and very well qualified to serve. Tell us about how that should be handled going forward.
Yeah, I think first of all it's important to understand the difference between the two. And actually, whereas there used to be a gulf, that gap has been closed. So DO, Doctor of Osteopathic Medicine, MD, Doctor of Allopathic Medicine, and traditionally DO's education was supposedly a more holistic approach, whereas allopathic MDs was more of an illness-based approach. However, that really has changed most recently, and allopathic doctors or MDs are just as interested in holistic, complementary, alternative care approach. Often the residency trainings for the DOs and the MDs are the same, and they do them in the same setting. And so I think that the gap that existed where there may have been some concerns about whether a DO is a real doctor no longer exists. So whether your primary care physician is a DO or an MD, you can be assured, as long as they've stayed abreast of the science and they know the services that they can provide and they understand your disease processes, you should get equally good care.
So patients need to be aware that there might be difference in terms of approaches for publication, so to speak, signage and all of those things. But basically, if people have attained a license to practice, they're probably meeting certain qualifications that they don't have to be worried about anymore, especially on a community basis.
Exactly.
You know, I think we got enough challenges to face in healthcare and medicine.
Without making an issue about that.
Absolutely.
I totally agree.
Yeah, it should go away. So why do we still have this problem of black men who show up having no care for eons or don't have a relationship with a primary care physician?
Well, I think we know why. Let's dig into that a little bit more. So when we talk about that 1 million people who don't have physicians, and African Americans, 28% of those are black men, about 17% of those are black women. And you know, there is a history of distrust, and that continues to play to some effect in us seeing black men not having primary care physicians. But it's bigger than that. Men consider themselves the provider, the head of the house. And so I don't have time to take off work to go be seen by a physician because I need to go to work and get a paycheck so I can take care of my family. That's extremely important. And that's a wonderful thing to say about men. However, at the same time, the part that is missing is that if they don't go see that doctor and get whatever that is diagnosed early, then there still isn't going to be anybody to take care of their family.
Exactly.
So that's part of it. They see themselves as the provider, as the protector, as the king of the house, you know, the lord of the house. That's not in a negative way, but in a positive way because they want to take care of their families. And then there's another aspect that comes into place here. I'm not certain that I want to know what's wrong with me. It's a little bit scary to go to denial, to go to a doctor and all of a sudden find out you've got something's going on with your prostate, or to go to the physician and find out your blood pressure is high. You mean I've got to go on a medication that's going to affect me in a number of different ways? So there's also some denial and also some fear potentially of what may come out of that visit. Those are some of the reasons I see.
What can patients be exposed to that will actually make them understand that, hey, this is a partnership in terms of your care? You're buying into me, I'm investing in your understanding, you're buying into my abilities, and it becomes a partnership in your care. I mean, where are we at on a scale of helping patients and providers understand that?
I think one of the missing pieces of that puzzle has to do with knowledge or education. People need to understand that if they have a provider, the expectation is that the provider provides certain things, and it actually starts with the provider being a good listener. I don't want a provider that does all the talking. It starts with the provider listening to what my concerns are, what my issues are, and then helping me understand what my responsibility is. So I really think it starts with education. And again, too often we start things at the end of the road when there should have been discussions and dialogue around those things in elementary school about the importance of the relationship between the doctor and going to the physician and why you need to see a physician and what the physician does. So I think education, knowledge about what physicians actually are capable of doing and why you need to see a physician now. Because if you see a physician on a regular basis, that cancer could be caught early and treat it, and you don't die. If you are seeing a physician on a regular basis, that hypertension can be controlled with diet and exercise instead of 4 medications, all of which have side effects. Not to mention, I've got these huge copays for me to get the medications. So understanding the role of the physician in really helping you to maintain your health really is a knowledge, a education. It's a trust issue. I can't minimize the whole issue around trust, because if I don't trust you, I don't care how smart you are. Until I know you care, I don't care how smart you are. That's a saying. I don't know who said that. Yeah. So it really starts there, I think, and that becomes a part of it.
Right.
Yeah.
Here again, it's about building relationships.
It is.
And if we don't begin to do that with a focus in mind, with direction in mind, with people who can lead, even if it's in silos.
And I think the other piece to add to this is not being afraid to ask tough questions. Why are you giving me this? Or why do I need to have that? So having courageous conversations is what we call them. Asking tough questions so that you can get answers to help you make better decisions about your health.
And making sure that we keep first things first. The ability to talk about the patient's role in this is paramount, and how they figure into this. A couple years ago, I was with the chief of medicine at Mayo Clinic, who's a personal friend, and we were traveling, and he was expressing to me how at the great Mayo Clinic that his people still can't get adequate and equal treatment. And I'm saying, what are you talking about? You're the Mayo Clinic. You know, I mean, he says, listen, I'm telling you what my experience is as a practicing physician. Yeah.
And you know, there's one more piece in terms of challenges that I just thought about, and that's known as health literacy. So if you talk to me and I don't really know what you're saying, but because you're the doctor, I'm saying, yes, doctor, but I really don't know what you said, that is another barrier. And we need to be very conscious that we're using the term now as plain language, so that people understand when they come into a health system, but into a physician's office, that we're speaking a language that they understand, and that the patient needs to make certain that if they don't understand it, they ask the doctor, break that down. I don't understand what you just said. So health literacy is another important component.
As a student, I was in an emergency room situation in a great city in this country where everybody in that community spoke Spanish, except me. And I couldn't communicate properly in an emergency room setting. And I'll never forget it, because it was a sick patient that I couldn't understand, and they couldn't understand me. So, and even in this environment that we have now, we still have this inability to communicate properly, even with the technology. We're not doing a good job communicating, and we know that because the outcomes are showing that we didn't communicate properly.
The outcomes show how we're doing.
Yep.
Absolutely.
Right. Listen, how did you become so passionate about this?
Oh, I think it started with my grandfather, who was born in 1898 and who died of metastatic prostate cancer. And I saw it, and I saw how he suffered, because at that time, really, the interventions, they just weren't there like they are now. And I saw him suffering, and I thought, nobody should really suffer like that. And that sort of started a desire for me, not only to help people, but to also take care of older people. So that was always my love. But here is what I believe. Here's my mantra. I believe that every person has the right to good health care. Going back to Martin Luther King's statement, every person has the right to have good health care. However, for every person, it is also a privilege. So when I make health care available to you, it's also your responsibility to walk through that. So it's the right to have good health care. Everybody should have that, Dr. Joe. And then there's a privilege that goes along with it in terms of a responsibility. That's how I feel.
Absolutely. For the historians in the audience, there was a physician who was part of the founding of this country who helped write the Constitution. And if you look in it, it says every person should have a right to health care. They understood it then without all the technology that we have now. They understood it then, and it applies now. We just have not paid proper attention to it and given it its proper place.
Absolutely.
But here again, you know, my mom said, when you know better, you do better.
You do better.
Yeah, but she made us believe that in various ways.
I bet.
But here again, you know, it just points out that we've got a lot of things to go. I think that leadership is important. I think that people will follow if leadership, they see the commitment from leadership is there. And that's something that we are lacking. We've bought into ideas, concepts, acronyms, and a whole bunch of other stuff that don't serve us well, and therefore we have not moved the needle very much in a lot of these issues that we have to deal with in healthcare. If we can get healthcare right, we can resolve a lot of other social ills, not only in this country but in this world.
I agree. And learning leadership, you know, some people, they say, are just born natural leaders. Okay, but you can also teach someone to be a leader. And we can't start when they're a fifth-year resident. Developing leadership skills and understanding the importance of leadership starts at a very early age. It starts when that 3-year-old is sitting at the table having cereal with mom and dad.
Absolutely. Good. Yeah. Gwen, this has been outstanding. Thank you so much for joining us here today. We will continue this for sure. Thank you so much. Our guest has been Dr. Gwendolyn Graddy. She is Director of Medical Education at PACE Southeast Michigan. Your primary care physician is your partner in health. If you don't have one, I encourage you to find one that you can trust and is invested in your long-term health and well-being. For primary care, I'm Dr. Lonnie Joe.